also hit on the difference between the Moderna vaccine, the Pfizer vaccine, and Johnson
I would
Johnson
love
vaccine,
that.
which is the vector vaccine that should be coming up soon. And that's different than the mRNA vaccines.
Okay, I'd love to hit on the two different ones and what that really means. So we're actually live on my page, but we can continue just, you know, talking until I get it up in the group and stuff. But that would be a great piece to talk about tonight.
Okay, and then Grant was going to talk about mental health strategies.
Okay, sounds good.
Are we allowed to curse?
Sure. Let it fly away.
I try not to curse every show. I make a real effort not to.
Did you just ask if we're allowed to curse?
Yes.
Have you been a part of the show the last 6 months?
No, she has not been able to join us before. So,
Oh, I thought you asked that.
oh, me?
Yeah.
No, although I'm trying not to curse, I'm trying to be a better person. It's not going well.
What does cursing have to do with being a good person?
I'm just trying to set a better
Right.
example for my kids. I'm trying to set a better.
I honestly don't trust people who don't curse. I'm like,
Have you seen the Netflix series that they have about swearing?
No.
You got to check it out. It's on Netflix. Megan, you look like you saw that.
No, I haven't.
Okay, well, it's what is his name? Nicolas Cage is the one who is actually doing that show.
Have to do with being a good.
No, I haven't.
Okay, well, it's yeah, so it's interesting. All right, so everybody, we are live. I've got it streaming a couple different places within the group and on my page. If you guys want to go ahead and use it as well, feel free. But we are here for another Blue Wave conversation. And I'm so excited. Of course, we have our fabulous Jamie. And we have Kim, who's in hiding. You guys can't see her yet, but she'll be on in a minute. But she's here, so don't go away. Vanessa won't be with us tonight, but she will be with us on Wednesday when we have our online party. Okay, so just want to make sure that you guys are aware of that. But today our guests are Dr. Grant Tower and Megan McCarthy. And we will have Jamie introduce these two ladies to you. We are honored to have them. We're lucky to have them. They took no chance in taking a chance in coming on this episode with us today to help educate us about the COVID vaccine. And so I just wanted to really quickly go over what we're going to do tonight. So tonight we're going to talk about COVID-19 vaccine, and we're going to talk about some, we might get into, you know, what's going on with the inauguration and still some things that went on at the Capitol. But I really want to talk about Wednesday. So Wednesday I put out there 11:30, but you guys can kind of get on at 12. That's usually when they swear in the new president of the United States. We are going to have a party. Oh yeah. So we're not going to go live in the group. We are going to do it all via Zoom because we have never gotten all of you guys who wanted to talk to us and, you know, just chat and share your feelings other than typing it in and stuff like that. We want to see your face. We want to hear your voice. We had always tried to plan. We thought we'd be able to get together and finally meet each other in DC. Of course, we're not going to be able to do that, but we're going to have an online party. So it will not be broadcast in the group. Please go to the events. Let me know that you're going to attend, and then the link is in that within the group. Okay. So we've got a party, and you can decorate your space. You can wear a costume, you can dress up, wear your Chuck tees and your pearls. And I've got some, I'll show you what I got from the party store. So I'm gonna wear these. and I have some blue eyelashes. Now I don't know.
Oh, I love it. I love it.
We're gonna try it out. We're gonna try it out. And so we're gonna have like a time where we change. So I have face jewelry. I don't know if you can see that, but I always wanted to wear it, so now's the perfect time, right? And got a little head ponytail band, and I have my whistle. So on certain words, you ladies that like to drink your wine or drink your soda or your coffee or whatever, whenever we hear a certain word, we haven't picked out what word that is yet. You'll take a drink, or I'll blow the whistle, whatever. We're just gonna have fun. So there's gonna be prizes for you all who have the best costume, if you're best dressed, different things like that. So we're gonna have a great time. And this is Wednesday. We're gonna start at, I put out 11:30. You can jump on if you want 11:30, but it's really gonna start at 12. And it's just gonna last throughout. So we can cry together, laugh together, complain together, and heal together. Okay, so moving on, I'm going to turn it over to Jamie so she can introduce these lovely ladies who took the time out of their busy schedules to help educate us. Jamie?
So first of all, I want to welcome back my very dear friend and one of my favorite people on the whole planet, Dr. Grant Tower. Grant finished her PhD at Dartmouth at the Theodore Geisel School of Medicine, and she's worked in medical education and the pharmaceutical industry for 17 years on a wide range of diseases, from mental health to epidemiology, virology, cancer, and immunology. We did give her a longer intro last week, but so we're gonna keep this one a little shorter since she has been kind enough to join us 2 weeks in a row. Also, I want to welcome Megan McCarthy. Megan obtained her BS in biomedical sciences from the University of Florida. And prior to doing her master's in public health, also at the University of Florida, Megan worked as a veterinary technician in an emergency practice. She went to veterinary school for 1 year before deciding to pursue public health. Megan has worked as a research assistant at the University of Florida College of Medicine, where she studied addictive properties of nicotine, so no smoking. Megan began working for the Sumter County Health Department in 2018 as a senior health educator and epidemiology and as the public information officer. She became a certified by the National Board of Public Health Examiners and obtained her CPH certificate in 2019, and in 2020, where we know there were not a lot of good things happening for the rest of us in 2020, but she was promoted to the biological scientist 2 and PIO at the Sumter County Health Department. And then in 2021, she was once again promoted as a biological scientist 4, and transferred to the I'm going to try. How do you say it? Osakalia? Can you correct this for me?
Osceola, but actually, I ended up not going because the Sumter County Health Department wanted to keep me. So I am now the epidemiology program manager for the Sumter County Health Department.
So you're so that's the update. You're responsible for disease investigations and surveillance. So I'm just going to ask, what is going on in Florida? Like, it appears there's no masks. The governor doesn't want masks. I mean, if anybody's going to get to herd immunity without vaccines, it would appear it was Florida. Can that even happen? What's going on?
Well, I can't recall any disease that has been able to be reached with herd immunity without a vaccine. I don't think that herd immunity is possible to be reached without a vaccine. The situation in Florida is kind of bleak right now, honestly. We're seeing a huge resurgence in cases right now. Most county health departments aren't even able to investigate all of their cases. So most cases aren't being called. Contact tracing isn't being done simply because there isn't enough staff. There aren't enough hours in a day to be able to contact and investigate all of these positive cases. We also have another problem, which isn't reported on a lot, that a lot of positives I find are not being reported. Meaning that they're not getting into our statewide surveillance system. The county health departments aren't being notified that there's a positive case, and those people subsequently, contact tracing isn't formally done on them. and they're not receiving guidance. And in some cases, they are proceeding with their normal lives. I'm heavily involved in trying to contain COVID-19 cases and do quarantine recommendations and exclusions in our school system here in Sumter County. And I'll have a parent call me. It happens multiple times a week, saying that their child is positive or that they're positive, and I have no record of it, and I have to go searching for a lab result. It's incredibly frustrating. So I think that the actual case numbers in Florida are actually is an underreport by significant numbers, which is very disheartening because the numbers do not look good. Where there was, even in our first two phases of shutdowns and executive orders to mitigate the spread of COVID-19 that happened earlier this year, they were never really super stringent. We entered phase 3 right before schools opened again, which was complete reopening. So restaurant capacity 100%. Everybody's basically able to do whatever they want. And that, unsurprisingly, has led to a drastic increase of cases, very significant community spread. It's not a fun time. It is not a fun time. It is very, very frustrating, and it feels like fighting a forest fire with like a water bottle. It's very, very frustrating.
Let me ask this question because I have something that came in from one of our viewers. And this is to either one of you or both of you if you want to chime in. But Lauren asked, for the vaccine that is currently going out, is it possible for COVID to mutate? 1, and 2, is there ever getting rid of this?
The question, are you asking if the vaccine has something to do with mutating or whether the mutations will affect the efficacy of the vaccine?
I don't know. That's the question coming in. She just says, for the vaccine that is currently going out, is it possible for COVID to mutate? So I don't know, Lauren, if you can clarify your question for the doctor, she can answer that. But I would think that she's asking, if you have the vaccine, can you get COVID from the vaccine? Lauren, if that's not what you're asking, let me know, but I think that's probably what she's asking.
And
Well, I'll say
think
that.
it's also worse.
Oh, sorry.
Not only can you have COVID from the vaccine, but we know these 2 new strains are coming. We have the UK variant and the one in Africa. Will the vaccine work on those variants? So I think there's 2 questions there that could be relevant to. I'm sorry, Megan.
Oh, no, it's okay. If that is the question, then the evidence that we have so far does state that the currently available vaccinations, so the 2 that have the emergency use approvals here in the US, the Pfizer and the Moderna vaccines, do appear to be effective against both these strains that have come out of the UK and Africa. However, I believe that there is a possibility that we could have some kind of antigenic shift that may render a vaccine ineffective. One thing that is kind of good about these mRNA vaccines, which are the Pfizer and Moderna vaccines, is if we do have some kind of shift of the virus to a strain that is not, that the vaccine isn't, the currently available vaccines aren't effective against, it's very possible that these mRNA vaccines can be altered very quickly and very easily to be effective against a different strain, and then just popped out and distributed in as fast as possible. So it is a possibility. I will also say that you can't get COVID-19 from the vaccines, and vaccination does, in a sense, drive changes in the virus. that is something that we know to be possible. So it's very important that we are able to vaccinate populations in a way that minimizes the amount of spread that a certain mutation might be able to have in a given population. So herd immunity is a fun subject because herd immunity changes based on geography, based on the various factors of a community. So if you're talking about a strain that mutates in one person in this community, if enough in that community are vaccinated, then there's a good chance that it won't be able to spread to other parts of the population. So it's just very important that we are able to vaccinate as many people as possible against the current circulating strains of COVID-19 in order to ensure that if these antigenic shifts do happen, they're not able to spread in a way that makes everybody at risk, if that makes sense.
So this isn't then like the flu where I could get the vaccine and then get a different strain and at least not be protected right now.
At this point, there's no evidence of that.
Dr. Tower, do you concur or what are your thoughts?
And I just want to clarify something that Megan said. So the vaccine does not cause changes in the virus. What it does is it stops the current strains from being able to infect people. So what happens is the vaccine, these strains that aren't susceptible to the vaccine then keep multiplying and take over. It's sort of survival of the fittest. So it's more that it just allows it to replicate, not that it causes any changes in the actual virus, if that makes sense.
Yeah, so I did have a question, Megan. I know we talked before the show. I'm somebody with really severe allergies, and I have a history of anaphylaxis in my case. I've never had anaphylaxis from the vaccine, but I've had anaphylaxis from other things. So we've heard these things about these allergic reactions to this vaccine. What are your thoughts on that? I mean, is it safe, or should everybody who takes Zyrtec not get this vaccine? How does it work?
So in regards to allergies, especially with people like you that have a history of anaphylaxis, the only true contraindication to actually receiving the 2 currently available vaccinations is a history of an allergic reaction to the actual contents of the vaccines. So if you look at that list and you know that you've had a reaction to anything on that list, that's a contraindication. Do not get this vaccine. However, if you have a history of an anaphylactic shock to any injection medications, for example, or previous vaccines, you can still get this vaccine. It's just very important to take in certain concerns into account. You want to make sure that you are monitored for at least 30 minutes after your vaccination. And you want to make sure that you have access to medical care in the case of an anaphylactic reaction occurring, if that were to happen. So that means having epinephrine on site, having medical professionals on site that can render that care and that life-saving medication. We have seen some allergic reactions happen, but in the grand scheme, when you're looking at now millions of people have been vaccinated, and we've seen, I would say, I can't think of the exact number. I don't know if Dr. Tower has an exact number, but I want to say it's not even 100 people have had an anaphylactic reaction.
Yeah, I haven't heard of even more than 20.
Yeah, I think it's a 2-digit number, but it's definitely less than 100. And when you're talking about millions of people getting vaccines, one example that I like to use is if you gave 1 million people a peanut, you would see a lot of people having an anaphylactic reaction in any kind of random sampling of a population of 1 million people. So it's less than peanuts. So when I read the safety profile data from the phase 3, the trial data, I was honestly in tears because it was better than what I could have ever expected. The safety profile of this vaccine is extraordinarily good. So I'm somebody with a very not fun history of allergies as well. I have allergic reactions to seemingly nothing. I have an autoimmune condition. So I was monitored for 30 minutes. I was happy to take that shot in the arm and nothing bad happened. So but that's just one person. What you really want to look at is what's happening in the population. And what's happening in the population is very, very, very little people are experiencing severe side effects or reactions from the vaccine. So I would encourage those with a previous history of anaphylaxis, as long as it's not to any of the actual ingredients of the vaccination, to receive the vaccine.
And one of the things I spoke about last week was that having adverse reactions like a hot arm or, feeling a little bit of what would be COVID symptoms is actually good, because what it says is that our immune system is recognizing it and it's reacting the way it's supposed to. So that if you come in contact with COVID, your body already has responded and has immunity. Do you agree that the symptoms are actually a good thing?
Yes, absolutely. It means your immune system's doing its job.
And
So go ahead, Mary.
I have a quick question, because I do a lot of stuff, but I also work in the school system during the day. And so where I'm at in Loudoun County, they have started administering the shots to employees. The system actually crashed with people trying to get the shot. Get the appointment, to get the vaccine. So this is also kind of piggybacking off the conversation we started last week, in protecting the staff at school and protecting the kids at school. While they have not decided whether they're going to go back to school yet or not, they're starting to roll out the vaccines. They've trained the nurses in the schools, and they're doing it at a specific school, and they're giving those injections to the employees. Is that going to be enough to protect them and the kids if there's not really a vaccine? As I remember from the conversation last week, you needed to be 16, was it?
It's 16 for the Pfizer vaccination, and it is 18 for the Moderna vaccination.
Okay, so I need to write that down. So 16 for Pfizer and 18. Okay. Okay. So how does that protect the kids? How does that work? So what precautions should teachers, staff take in the schools? Because the elementary school kids, they're snotting boogers all over the place. They're coughing and playing with their friends, and all of that. And high school, you can't keep them off of each other. The boyfriends, the girlfriends, they just like this in the hall. You can't break them up. I work in a high school. So what do you recommend for that type of environment?
I recommend the same exact precautions that have been recommended all throughout 2020. Even with staff vaccinated in a school system, if you still have community transmission going, which is happening everywhere, and as long as you don't have a herd immunity within certain environments, and in this case we don't have children that are able to be vaccinated with these vaccines yet, you have to practice all the same precautions. Mm-hmm. Even two people who have been vaccinated fully should, if they're not living in the same household, should still be practicing all of those precautions, including masking and social distancing. Especially since we don't have enough evidence to say that a person who is fully vaccinated is unable to transmit the virus further on if they were to be exposed to it. So even in those environments, I do encourage the staff to become vaccinated. We know that while it can happen, I'm not saying that it doesn't happen, but we do know that COVID-19 infection in younger individuals, especially children, tends to not be very severe. However, most of the staff in the school system is likely going to be put into a category of an at risk for a poor outcome if infected with COVID-19. So it's still mitigating some risks, but it's not mitigating transmission. So it's still very important to practice all of those same precautions that we've been saying all year.
Okay.
Also,
So
the
if you have
vaccine.
a shot doesn't mean you can take your mask off.
Correct.
Mary, one thing also is that when they say the vaccine is effective 95% of the time, so the 5% don't build an adequate immunity. Always assume you're the 5%. That way you're safe. Assume that even though you got the vaccine, maybe it didn't work. So just take all the precautions, washing your hands, don't touch your face, wear the mask, stay away from people,
Okay.
and try to get
What
a
about these?
quality mask.
Oh, that is a good question. What is a high quality mask? We're seeing more about a high quality mask. How do I know whether my mask is high quality? I mean, I personally, I wear an Envo, and it has, I know mine had an event, and I had to plug that up. If you buy that, it comes with the plug. And mine is an N95. Is that actually any better than other masks or than KN95s? How do you really know you have a high quality mask?
Megan, do you want to take this, or would you like me to?
I could take it. What's recommended is at least 2 layers. The more layers that you have, especially when you're talking about a cloth mask, the better. The KN95s, I feel, are probably a little better than the cloth mask, but part of the problem with saying this is better than that is we don't have the best evidence or the best studies to kind of suggest one way or another. I recommend at least 2 layers, so at least 2 plies. 3 is better than 2 though, when talking about cloth masks. One thing that I find is people will get N95s, or they'll come upon them on the internet and order them and think that that's foolproof. And I do want to drive home that is not the case. N95s are not foolproof, especially if you are not properly fitted for one. So those people who are in the medical field who wear N95s have actually had testing to ensure that the fit is correct. And if you lose or gain 10 pounds, if you have facial hair, I mean, all of that can factor into how effective a mask is, especially an N95. So I do want to get that message out, because I do hear that a lot, especially when I'm on the phone with doing a case interview. I had an N95. I don't know how I got it. It's not a foolproof method. So I think that's the best advice that I have. That if you have anything to add, Dr. Tower.
Again, that's what the 95 is. It blocks 95% of particles. It does not block 100%. The only foolproof is if you are alone in a place, no people around, you don't leave, no one comes in, for weeks, then you can say that you're 100%. But if you plan to live on this planet with other people, you're never going to be fully covered. So just try to be around people who are taking precautions, and take your own precautions, and try to respect everyone's space. And, it's hard, but it can be done, because there are other countries that have done this.
Okay, we've got a couple questions coming in, which is great. Thank you guys for shooting these questions in. And you may have touched on some of this, but if you could just address it real quick. Lauren again asks, is the vaccine safe for women in their first trimester or women trying to conceive? That's a great question.
No data.
Mm-hmm.
There's 0 data on this, because they haven't done pregnant women are often left out of clinical trials because of the safety issues for the baby. I believe they're starting some trials, or at least a registry in pregnant women, but we don't have that answer right now. I wish I could give you a better answer than that.
And I've seen some doctors online who are pregnant who have posted when they got the vaccine. So that's not part of a trial. That's just them making the choice, or how does it happen?
Yeah, what I've told patients or residents that have asked me this question is you have to consider all of the risks. You know, you have to do a pro and con. I recommend anybody in that situation to have a discussion with their physician to come to the best decision. But that's really a decision to make between you and your doctor, because we know that COVID-19 can have adverse, COVID-19 infection can have adverse results or outcomes in pregnant women. So if a pregnant woman is in a high risk environment or something like that, it may be better to take whatever minimal risk comes with the vaccination over not being vaccinated. But that's really a discussion to have with your physician.
Great. Thank you for that, ladies. Lisa, and I think you guys touched on this a little bit, but Lisa asks, if you're vaccinated, you can still pass the virus on to others. That's correct?
We don't have a lot of data about it. We're waiting for better data, but we have some evidence suggesting that. But more importantly, we don't have evidence that disproves that. So the recommendation right now, until we have a better idea, is to take those same precautions that we've been recommending even when vaccinated, because there could be a possibility. And like what was said earlier, the vaccine is 95% effective. So 95 is an amazing number, but when you're talking about 5% of a very large population, that's a large amount of people who think that they're protected and they're not. So the best thing to do is to take all of those precautions, especially while we're having such high community transmission.
Awesome. Anything you want to add to that, Dr. Grant?
No,
Dr. Howard?
I completely concur. We've been a year into this. Think about how much we do know. That's pretty amazing. So, the scientists are working like crazy and the doctors to try to get these answers. So they will be coming. We just don't have it now. And I wouldn't trust it right now.
Mm-hmm. Yeah.
You know,
we have another question
100%.
We have another question from Arabella. She says, about how long will it take for us to see a vaccination working by seeing a decline in the numbers? So basically she wants to know, with the vaccine being out, when can we start seeing in the future a decline in the numbers that seem still to be rising?
I would say late summer by the earliest, honestly. Yeah.
Late summer?
But it's very hard to make a determination of a timeline like that, especially with the way that this vaccine rollout is going. The distribution system has many flaws. Oh gosh, it's not fun. So with so much up in the air, it is very hard to make a timeline. If we increase our vaccination efforts, if we have more of an uptake of vaccination, that could speed it up very rapidly. But if we're not getting enough vaccine into arms and we have a low uptake of vaccination, then this could spread on until next year and the year after. So it's really hard to make any kind of estimate of a timeline with how variable uptake and distribution is right now.
Okay. That number, I know President-elect Biden was talking about, Jamie, I don't know, I'm sure you might have a stat on this, but he was trying to get a certain amount of, and they thought it was kind of far-fetched. I think it was at 100 million. Am I?
100
million in
100
100
days.
days is our goal. But
Yeah.
that may be derailed based on the supply. You'll find this shocking, but the Trump administration lied about the number of vaccines that we had available that they were holding back. So a big driver of whether we can accomplish that task will be whether the vaccine is available. President Biden, who will soon be President Biden, has said that he will also address some of our problems by using the Defense Production Act. He can't necessarily use that to produce more vaccine. We're already doing all we can for that. What he's going to be doing is making sure that we have all the supporting supplies available in order to do that. So we will have enough syringes. We will have enough alcohol wipes. The alcohol wipes were, my mom is a type 1 diabetic. And for a while at the beginning of this pandemic, you couldn't get alcohol wipes for diabetics
You
because
couldn't find
Yep,
alcohol.
because- yep.
And
And
that's
so yeah, well, the drinking kind is way more fun, but that doesn't help my mom stay alive. So, I mean, that is something that we need to think about, is the entire supply chain required to roll this vaccine out safely. We need to have enough people who can give the vaccines. We need to have enough syringes, enough alcohol wipes. All of this has to come together, and the current presidential administration has not used the Defense Production Act to address this, the same way they didn't do masks from the get-go. So keep in mind that Pfizer did offer us a large number of vaccines earlier in this pandemic, and President Trump declined. So here we are trying to figure out how to go forward and get enough vaccines to get us to herd immunity. Do our guests have anything to add to that, since I can only rant on the political side?
Hopefully he'll also join the consortium in India that is also supplying a lot more vaccines that Trump basically refused to join. So that we'll be able to get more vaccines produced.
And we do have on deck Johnson & Johnson's vaccine. I know they were trying to test that down to age 12. And that's one of our hurdles in reaching herd immunity, is that when we're taking a good, 10% of the population or more and saying you're too young to get the vaccine, reaching, 90% herd immunity, which was a number Dr. Fauci threw out, would mean that every adult would have to get that vaccine. So the hope is we could reach herd immunity prior to that number, but AstraZeneca has a new one coming out. They're looking to go down into teenagers as well. And then Johnson & Johnson said in October they wanted to start their tests on children. They're moving forward. They did have a few hiccups along the way as far as vaccinating our kids. And children are having problems. And we've got this new strain coming out of the UK, and that's different for children, isn't it, Dr. Tower and Megan?
It does seem to affect children similarly as it does adults. So they're finding that hospitalization rates are now equal in adults and children. So for whatever reason, children are having a greater reaction to this strain. But we don't know whether it's more deadly in children. We just know about the hospitalization. So they do have a more severe course, but we don't know if it causes greater death. It's just too new.
Okay, we've got a bunch of questions. Wow, this is great. So I'm going to ask this one, and I already know the answer to it, so we can just do this one really quick. Lauren says, is the mask there to prevent you from getting or spreading, or both?
Both.
I knew you was gonna say that. Both.
But can I ask, because I know, hi Lauren, and I know her situation. If you're trying to protect yourself as well, we know your mask does a better job at protecting other people if it's a cloth mask than protecting you. What is it worth it to get an N95 or move up to these stronger masks? Would those actually give you some more protection?
My opinion is it's best to social distance than get those masks. I think a lot goes into that. We were having a lot of problems procuring N95s for medical professionals that are working in, COVID units and long-term care facilities. I used the same N95 mask for almost 2 months because we couldn't get my specific size. And I was going into long-term care facilities, doing assessments and doing infection control kind of inspections. So as long as there's enough of a supply, if you can get one, but again, I don't want that to give any kind of false security, because a lot of times, and I've seen it, and we have evidence of it, that you will change your behavior if you think that it protects you more. And your behavior is so important right now. So even if you do kind of ramp up the mask, it's still so important to take all the other precautions. You really can't waver in any of them. So I think it's kind of a complicated answer there. If you have anything to add, Dr. Tower.
I was gonna say with the mask, if it's on and you blow hard and you feel it come out, the air in certain places, then you're not fully protected. You know, when you have the mask on, if you blow hard and you feel, you know, make sure that it's against your skin. It should be fully touching your face. If it's not, then remember you're getting air pockets in. And then I'm talking about the N95 or KN95s. The masks that are cloths, I mean, the best protection you're getting is about 60% when it's different fabrics, and not wearing it over your nose makes it ineffective. So everyone has to wear it over their noses.
Megan.
Yeah, can we emphasize that? Because I've seen the research showing that COVID is actually more likely to spread from and to your nose than your mouth.
Yes. Yes, that is very true. Yes, I can't say yes enough.
Yeah, because there's more receptors for the virus to glob onto and go into your cells in your nose.
So I actually have a question from the group. How should all of this affect school in the fall? And if we choose to use virtual to minimize exposure, I'm thinking we should keep doing that at least until next year. Your thoughts?
Where is this person?
Doesn't
What's the
say.
community transmission like in this community?
Very
That's right.
high, I would suspect.
Where?
I don't know where she is
Oh.
located. Let me see if I can find out.
So are you asking that because I know that in my school district, we've spent a lot of time looking at this concept of the R0, which I know Dr. Tower explained last week. And that's a big driver. We're looking at both our percent positive, which in my community is 17%. And we want, yeah. And we want that below 5%. And so we've tried to set up metrics to say, this is when it's going to be safe to open the schools. Should it be metrics driven? Do you think we should have a national policy? How do we make those decisions safely?
I would say, to answer the initial question, it kind of goes back to when will we start seeing the numbers drop? It's so hard to make any kind of future timeline or determination of what the virus, transmission is going to be like in fall this year.
The new strains make it even harder because they're much more infectious.
Mm-hmm.
So I'm going to go with don't plan on anything. Just assume that it's not going to happen.
Yeah, planning for worst case scenario. Absolutely. My gut feeling is if it were my hypothetical child, because I don't have any children, I'd probably be planning on virtual school. But things can change. Things can change very drastically within these next, 6 months. It really, really can. So it's really hard to make that determination.
There is a heavy push for school. There's a heavy push to get these kids back in school. I think it's too early, personally. I think it's going to take something tragic, unfortunately, for these parents to back off. I think these school boards should spend their time and COVID monies that they got from the government and put it toward trying to build or get better platforms to teach these children on while they're in school, and find out how to better serve the kids who are falling behind. There are a ton of kids falling behind in school, a ton. And these school systems, and I hope y'all are watching, because I'm not scared to say what I'm about to say. You need to take those COVID monies that you got and stop putting $15,000 cameras in the school to take their temperature and spend it on educating these kids that are falling behind in school. I know our county for sure has a camera in every one of our schools, 92 schools, and they spent $15,000 on just the camera.
But this camera is to check temperature, right? This isn't like a camera like for virtual.
It's a camera to check the temperature. I don't care. They have these kids failing. We've got seniors failing. We've got juniors failing. We've got kids that don't even know what an education is because it's their first year in elementary school failing. What we did not need was a $15,000 camera in these schools, and they're not even in school.
They're not even going to work or stop the
Yeah,
spread because you need a temperature, and most kids don't have a temperature and are full of COVID virus.
That's
Do
right.
even all adults run a temperature though? Because I thought I read somewhere that we have a whole lot of people who
no.
get COVID and get really sick and don't even run a fever. Can that happen?
Oh yeah.
50%
Oh,
of people are completely asymptomatic when they have the virus.
Yeah, even those who are symptomatic, I find, I almost want to say the majority don't report to me that they ever had a fever. And on top of that, those cameras, the theometric, I don't even know the word,
They are.
detectors and stuff like that,
Mhm.
they don't even work. They're not even accurate.
It's a waste of money. Let me tell you, it's supposed to. So if you have a drove of kids coming into school, it can scan 30 kids at a time, and it's supposed to put like a little red light over their head if they are not wearing a mask, which you should be able to see with your eyes, and their temperature. So if their temperature is higher than 96, whatever it is, you can pull them and take them to the side because it takes a picture of the kid or whatever. First of all, is that even a violation? Do we even talk about that as a school system? How many parents really want a system to take a picture of their kid with the temperature so I can go get them from class or stop them from going into school and pull them into one of the unit rooms that they have to monitor their temperature and check to make sure if they're sick or not? I think 15, but I'm going to add it up real quick. That's a lot of money.
We did have while Mary's doing that, I'm sorry, go ahead, Kim.
No, I'm sorry. I was just going to say really quickly that, to Mary's point, we're all kind of, I think, skirting around when answering these questions by thinking that it's a lack of information or a lack of understanding that these things are just common sense. The real core issue is going back to what we were talking about at the beginning of this this call today. The difference in how different races are responding to this pandemic, the conversations surrounding the implications of this pandemic, and who statistically it's proving itself to impact, and especially in states where there is a stronger Republican stance, which in this county it's divided. You find that's where the core questions resound. Virginia didn't place those in there because they anticipated on providing safety measures for children. They're trying to push the narrative that we need to get the kids back in school because the constituents are pushing the narrative that we need to get the kids back in school. And why are they pushing that narrative? Because it's not affecting them. Not in Loudoun. Not that they think.
Let's say the stats too.
Based on the messaging that they think. Because the messaging is that this is a minority illness. It is impacting our community at a much higher rate. So when you hear the conversation of the kids aren't getting sick, if you're sick, then just stay home. It's because it doesn't impact them, so they think. So they're pushing the narrative that the kids need to be back in school. And Loudoun is falling in place with it.
They are. But $1.38 million. I just wanted to throw that out there.
It's psychological, these cameras, because it makes them feel like they're doing something.
Right.
And that, look, we're investing in minority schools. We're putting in this expensive stuff to keep them safe. It's a lot of psychology that they're doing something, because constituents are screaming, you're not doing anything. My kids are still home. You know, I can't go to work, blah, blah, blah. And so they're like, we have to do something. So this was their something to make them feel better.
And I think we also see these groups who are, to Kim's point, who are screaming to open the schools. It is mainly Trump supporters, not always, but predominantly. And they think they're the silent majority. They are neither silent nor are they the majority, but they're so much louder than those of us, I think, who are saying, and I will say, I'm a mother of, I have 3 sons. One has ADHD and one has ADHD and severe dyslexia. They are struggling. And my 3rd son has developed some anxiety dealing with this situation. So my heart goes out, especially to parents of special needs children. I have a severely dyslexic son. I am in no way, shape, or form prepared to help him with his schoolwork. I don't have the background. He's really struggling and he's working his butt off. But the voices we hear screaming to open these schools are so much louder than those of us, I think, who are just like, okay, this is what we need to do. I'm going to do it. I'm going to hunker down. And it is disproportionately affecting, of course, women of color. And I think there is a group that are perfectly fine when they look at a stat and say, in the United States, Black people are 3 times more likely to die of COVID than white people. They're fine with that.
Mm-hmm.
And we have to figure out how the voices on the side of science and making evidence-based decisions somehow become louder, because I think science speaks softly because we speak the truth. You don't have to shout when you've got 350 pages of the report, I think, that went to the FDA on the Pfizer vaccine when it was approved. When you have all the data, you're generally not screaming. And I hear a lot of screaming, to Kim's point, from the other side, and it has been so politicized.
Yeah, it's very unfortunate.
I was going to say, if any children go back to school, it should be highly prioritized to first focus on children who have special needs, whether it's emotional special needs or learning needs, because then they can get the extra help. It shouldn't be because, the 5-year-old screams at home more than, they can tolerate. It really needs to be a prioritization system of those who are going to be most affected negatively.
I would like to add, I'm in Florida. We opened schools in August.
I'm in Florida.
It's been an adventure. One thing that's so important that hasn't been done really is we need government support, financial government support to families, to individuals, especially if you're not sending your kids to school. I mean, I'm in charge of quarantine. So, I mean, I get the seating charts and everything, and I make circles and I do all that stuff. And I call the people to tell them your kid can't be in school for 2 weeks. And I cannot tell you how many times, the parent on the other end of that conversation says, I can't stay home with my child or I am going to get fired. I'm going to lose my job. And sorry, too bad.
Can I ask though, Megan, isn't that parent almost always the mom?
Oh, yes. Oh, yes.
And so we know that the economy in December lost 140,000 jobs. All of them were women. If you've been watching our program, we've been talking about how this pandemic has disproportionately impacted women in the workforce, and even more so women of color. For months and months now, we have seen this coming. The damage to women's careers as a result of this pandemic will take us back 20, 25 years. How do we get these jobs back? Vanessa did a great show a few weeks ago on, how you get a job after this. But these career fields, women, even in families where women are the primary breadwinner, they're often the default parent. And even if it's a 2-parent household, they have to quit their jobs and find some way to survive on the salary of their partner. that may be less than theirs because we've got these kids at home. So I want to just say that if you're in a position of great privilege where you can't imagine saying, well, I can't keep my kid home, that we have to acknowledge that that's privilege. There are families out there, to Megan's point, who really are going to lose their job. And
that's
this
why we
fall on women.
And that
Go ahead, Kim.
actually has come to fruition where the last jobs report, wasn't it 100% of the jobs lost were
Yep,
lost?
140,000. I'm sorry, and Kim, you were saying?
that is, I'm sorry, I'm stuck on that number. That's astounding. But I think that, and I always have to be an advocate for this group because that's kind of the group where I, historically have always been. And I do believe that no matter which area you're in, there is some level of an attack on this space, and that's the middle income families. You have the higher income families who can afford the resources to be able to have people come in and tutor their kids and do sports games with their kids. And, they probably live in bigger homes where they have more space to be able to do things with their kids. So there's a different quality of living during times of COVID. And then you have the lower income that are able to get some sort of assistance or resource to help them navigate the conversation. But then you have that middle income family that, one, first of all, may not know how to navigate resources now that they're finding themselves in this space because they may not be part of the generational demographic that knew how to find and locate resources. So they're being confronted with it for the first time. I found a lot of the families had, there's a term for it, but basically the avoidance of getting the assistance because mentally they've been socialized to demonize, that space, although they now find themselves in it with the most of the globe right now. But then also, like you said, they're busy working. And so they don't, they're trying to keep a roof over their head or trying to keep their job to pay their bills. And so excess is not even a term, but their children are lacking because their parents are working. And so that is an area that I hope and pray under the new administration, there is some level of focus. I think when we talk about those women who lost their job, many of them probably came from that space. And so now they're having to navigate that space. And how do you sustain if you don't have the experience or the information? And I think to the other point before about people not faring well, and I think a lot of that comes with it as a perpetuator because they don't know how to navigate or how to fare well in this new environment.
And I know that this is a mental health crisis for so many people. Grant, you had some perspective on how COVID is impacting mental health, not just when you get COVID, but what for those of us, like I don't have COVID. So far I've not gotten it, hooray. But I will say that I've spent, as a high risk person, the last year almost now we're approaching a year, honestly, in some ways fearing for my life, because I know that my odds of survival are probably better in Vegas. So what would be your advice for people on what we can do for each other and for ourselves as individuals to navigate the mental health part of this?
So we have to remember that the pandemic is only one crisis we're going through right now. We have multiple crises on multiple fronts, and nobody is being left behind on this one. And I have predispositions because I'm bipolar and I have PTSD. So the crisis of mental health has been even greater. My anxiety is through the roof. I know a lot of people have been saying this as well. I don't think anyone is getting out of this, without having some mental health challenges, whether it's anxiety, whether it's depression. Loneliness has been tied to worse outcomes if you do get COVID. And so, and I know in, Black community, you need to not have, I'm not going to, you have to be stronger, with everything. And, one of the things that is really important is to be honest with our feelings, and to experience them and not have, that you don't put a judgment on them because, not that other people have it harder or that, I have to be strong. You have to give yourself space to feel your feelings and to find acceptance that right now I'm struggling, or right now my child is really struggling in school, and that's making everything harder for me because, my child is having struggles. And a lot of things that, we do, we're all judgmental, especially on ourselves. And, give yourself a little grace. I call Jamie. If I'm having a tough time, I call that one person that always makes me feel better when I get off the phone with them. As part of my addiction program, I call 3 people a day. It's staying connected during this period of isolation that is going to improve, the outcomes of us, both in terms of staying, not dying from COVID, as well as not dying from, as they call them, deaths of despair. I found that my anxiety is a lot worse than my addiction, and I feel safer at home. People with anxiety or addiction problems actually feel safer at home. So the isolation didn't affect us in that way. Lockdowns, if we have to have them, it's really just staying connected with others. Some of the other things in terms of that I cope with is, when we're talking about economics, free things. Facebook has some, great groups that you can join for whatever, whether it's gardening or you're bipolar or you have addiction. There are some really great groups that are very supportive. Some other things, I use Happy Color. It's an app on my phone where it's color by number. And the repetitiveness and being able to, bring your mind away from whatever's bothering you, even if it's for a few minutes. There's a meeting guide if you do have, addiction issues, but want to find a meeting or find online meetings, because they are out there and they're very, very prevalent, no matter what your, your inadequate coping mechanism is. There also is a podcast that I love. It's called The Science of Happiness. And it's actually, there was one where a woman was talking about, her experience being a Black person and really finding that shared experience or that shared space and feeling, people who will make her feel accepted, and having that network of people who are accepting her and just, telling them that they're beautiful.
Well,
You're beautiful, Kim. And Jamie, you're beautiful. Megan, you're beautiful. I love your eye makeup.
Your eye makeup is on point. That looks really good.
It is on point.
And Mary, you're beautiful, and I love your shirts. It's just finding that
Do you
appreciation.
guys see Vanessa's shirt too? Vanessa's looking hot tonight.
He always has a shirt.
I can't see the Vanessa shirt.
It says, I miss Barack.
Don't we all?
God.
Especially after this week.
And we'll post them later, but crisis hotlines. If you find that you're in crisis, there's no one better than someone completely anonymous that you can talk to about what you're going through right then, who understands. They're not going to judge you. They hear 80 million people who are going through similar things all day.
that actually brings us to a question on the post. and I don't know, I don't think it was asked yet. It said, I've been hearing of people getting neurological issues after the vaccine, but I guess we could also lump that in with COVID, or having COVID or going through this experience. Is that a side effect? And is it temporary, or are we able to reverse some of the issues?
I don't recall any reputable source citing any neurological issues after vaccination.
I haven't heard the vaccination. COVID, on the other hand, they are finding does infect the brain. So they actually have found COVID in cadaver brains who had COVID, that it does infect the brain and it causes neurological issues. Psychosis can cause in some people. It makes some of the breathing issues worse.
Yeah, I also, if you look at the,
Question
if you look in, go ahead. If you look in the chat, I posted an article about the neurological issues that Dr. Tower is talking about, if you want more detailed information on that.
But from the vaccine, the only severe things we have been hearing is the anaphylaxis. You know, if you get fever and you feel like you have COVID for like 2 days, like that's again your immune system just recognizing and mounting a response to protect you from COVID.
But we've got some thank yous. Lisa says, please thank the doctor and please thank the doctors for having the strength and courage to talk about mental illness and trying to reach all races of people. So thank you both.
Oh, thank you. That's so nice to hear.
Yeah,
It's not talked about enough.
it's
It
not.
really isn't.
It's not.
Yeah.
And it's something that I think we need to address, particularly because of the times that we live in, because not only are we dealing with COVID, first we were dealing with a lot of the racial tension and COVID, and now we're dealing with the extreme version of, you know, worrying about the safety of our lawmakers and our president, incoming president, and vice president. It's stressful, you know, and the conversation that we had before we actually got online, if you guys are watching this, for those of you that are watching, we always have a show before this show. We always get into these conversations that are so meaty and juicy. Sometimes it's what stems some of these conversations. And when we first came on, we started talking about that. And I think that is definitely something that we're going to need to address going forward, because, you know, just watching and seeing how they have to prepare DC for something that is supposed to be a peaceful transition is unnerving, no matter who you are. You know, I don't know how you guys feel about that. I just have a problem seeing our National Guards sleeping in the Capitol on the floor because somebody thinks they can do what they want.
To protect us from an attack by other Americans.
Mm-hmm.
Let's call them out for what they are. They're white supremacists, conspiracy theorists that are
Domestic terrorists.
Domestic terrorists.
terrorists.
Mhm.
That's what I call them.
And they are here back in DC. We had already just today, they arrested someone trying to get past the restrictions with faked credentials to get into the inauguration.
From Virginia.
And so he had over 500 rounds of ammunition. Of course, he had an unregistered gun, and he had fake documentation. The other thing is, right here in the town I live in, one of the members of one of my groups was harassed at the grocery store yesterday. And it was somebody who said that they had driven 960 miles here to stop the steal. And of course, this person was in the grocery store refusing to wear a mask and being loud and telling everybody why they're here. But these are homegrown terrorists, and they're here, and they're dangerous.
Well, did you politely tell him, I'm sorry, sir, but you came 900 miles from that?
Well, if you look at what Parlay is saying, they really and truly believe some things that are so far removed from reality. They think President Trump is going to be using the emergency broadcast system. There's going to be a blackout, that millions of Americans are going to be rounded up and arrested. And I think for me, what's most disturbing isn't just that they believe this, but that they wish such harm on their fellow Americans. How can you consider yourself a patriot and not love other Americans?
Because they believe in this ideology that everybody that feels this way is on the left, or they are part of this liberal agenda. And it's, you know, those key buzzwords that have been branded throughout this inauguration, I mean, this last 4 years of the administration, to excuse or overshadow what the things that are really happening, that are really hurting our country, and the conversations that need to be dealt with. And they're holding on to it for dear life. Plain, you know.
Yeah, it's radicalization. It really is. These people believe that what they're doing truly is the right thing to do for the country. They are ingrained in that. So
Everyone believes they're the hero of their
Yeah.
story. Nobody ever thinks they're the bad guy.
Not even Dave LaRock, right, Vanessa? Oh, okay.
Let's not,
For the record,
What happened?
let's not get me, excuse me, let's not get me started on Laurent.
No, please,
Okay.
because I've been waiting 2
So
days
it's
for your
my,
video.
it's my life, it's my life's mission to drive him out of office and to get someone that's decent and someone that won't call us colored people in 2021.
for people watching outside the area,
For
I
Dr.
think
Grant and Megan, we have a delegate in the area who was at the Capitol that given day, right?
great.
You're an elected official. He was participating in the event.
had
He was
several
brought
in the
outside. When he was called out for it and he was asked to resign by officials in our area and a lot of the, community, he said to our board of supervisor and others that maybe they should be more hands.
Concerned.
Basically, what he was saying, they should be more hands-on with the colored community.
He said we should be more concerned with addressing the problems within the colored community.
Holy shit.
Whatever he said, colored community. He could have said, y'all going out eating donuts with the colored community. He could have said whatever he wanted to say. The fact of the matter is, the words that came out of his mouth was colored
in
community.
writing and posted to the internet.
Huh?
This wasn't in writing. I mean, this was in
Yeah.
writing and
Yeah,
posted
he
to
didn't-
the internet.
He didn't say it, Mary. Worse, he put it in writing on the internet.
Yeah. And let's also put this man into context for people who are not from the area. This man is a COVID denier. He was encouraging people to not get the vaccine in November because he said the pandemic is over. But, is it over? Did I miss something?
Wow.
That was in November.
That's news to me because
He
Yikes.
is a
Megan,
outright
Job.
he was an outright homophobe and has just said horrible things and terrible things and been very opposed to gay rights and trans rights.
He's
He
part of the
said
Stop the
being
Steal
gay
crew.
was bad for your health. I think he compared it to smoking. And to make this even more fun, I have not seen proof of this, so I can only talk to allegations made by other parties that he seems to think it's okay to send really flirty messages to women on his Facebook page. And he's married. So he is just an all-around winner, racist, sexist, anti-gay.
You forgot the charges that he was facing for.
Oh, you should tell that story.
trespassing. Yeah. So he's Christian, and he's
Obviously.
going for the Christian vote. And this whole Stop the Steal by these liberal socialists who are trying to overthrow our nation and take away our rights to believe what we believe. And
I think somewhere there may have been a Eat Babies, but maybe I could have caught that somewhere else. I don't know.
Only on
But-
Tuesdays though, but
Yeah,
And
only
he
on-
told a nurse she's a baby killer.
yeah, but for one of his neighbors, they have charged him with trespassing because he went on their property and basically told them, like, you know, you're evil and you're this, and denouncing them for supporting, you know, this whole liberal thought process, and they're going against God, and I think they had something on their property that he ended up trying to run over.
He allegedly lunged his car toward the woman.
Yeah, he did. That's what he did.
So it was her he tried to run over. So I thought it was an. I'm
He must
sorry.
be friends with Rand Paul.
Well, and I think we need to also say something, and I'm very open that I'm a Christian woman. I'm a person of faith. I was raised in the church. I continued my faith in Christ. It guides me. Maybe I don't listen quite enough, but if I were, the Cornerstone Church is the one he's a member of, right? He
That-
says he will
Oh, no.
always,
that figures.
he says that he will always be elected because his church will vote for him. And I'm issuing a challenge right now to members of that church. Is this really a man who's living in Christ? Is he a
Are they-
follower
but
of
are they
Christ?
living in Christ in that church?
I don't want to go there. I really don't want to go there. But if we're going to talk about the church, let's talk about the pastor. Okay? Because he is the head of the mess that's going on. And the apple doesn't fall far from the tree, and the sheep don't fall far behind the shepherd. The people that are there have the same belief as the pastor, or they wouldn't be there. And that's why I'm gonna leave it.
So I don't know. You guys are in Florida.
Yes.
Yeah.
There's a lot going on up here in Loudoun. There's a lot going on in Loudoun.
Oh,
And it has a long sordid
Loudoun's
history with
busy.
race that it still hasn't
And-
seemed to
Loudon
successfully
is busy
navigate.
because Loudon was the last of the last to segregate, to take away the segregation of schools. So you still have the good old boy network. You still have the hood wearers. They don't come out in the open now. They just wear red caps. So we still have that mess going on out here. We still have the Ford F-150s driving around with the Confederate flags, trying to put down intimidation for the people that live here. There's plenty good people that live here. Just like a bag of apples, there's always a few in there that tries to spoil the bunch. And that's what's going
And
on
we
in Loudoun County.
But the problem is, Mary, though, in Loudoun County, these people sometimes often are our school board members or our
No,
government
not
officials,
often.
or
They
I
are.
was trying to give them the benefit of the doubt. But yeah,
Call
you know,
a spade
so
a
it
spade.
makes it a hard line to navigate because you have to deal with these people. I mean, you have the right to believe what you believe. I really
Mhm.
care less. But when you're in a position that impacts others, especially as a public servant, that's when I have a problem.
I agree, 100%.
we have DeSantis. He's actively trying to kill his constituents.
That's true.
yes. Yes.
Donald Trump might want to have rethought the strategy of killing off all these boomers. I wonder how many states he lost just because there weren't enough boomers and traditionalists alive to vote for him because they died of COVID. I mean,
Well,
makes you wonder.
they said that the early voting lines were packed down in Florida with the senior citizen community. They did a news segment on it during the election. And I was like, yep, that's all the people that remember what he said.
I'm in Sumter. I work in Sumter County. I actually live in Orlando, but I don't know if you guys know this, but Sumter County has the Villages. If you're familiar.
I am familiar with my boyfriend's
My
best
family-
friend wants to retire to the Villages, and I've already told him that I'm not going with him.
Why not, Jamie?
So
You would do so well down there with the old folks. What are you talking about?
no, I love you, honey, but we're not going to go live in the Villages ever. No.
Just so you know, the Villages is the largest elderly community. It's like, what is it, 100,000?
It's more.
It's more, it's huge. And they're well known for the herpes outbreak.
Okay, no, wait, I gotta step in. That is actually a lie. Yes, yes, yeah. So there, yeah, no, it's a rumor. So what happened was, like, some reporter misinterpreted some data, and they published this article saying that the Villages had like the highest STD rate in Florida, but they misinterpreted the data. But so many people were so like intrigued in the idea that all these old people are just have rampant sex with each other that everybody just ran with it.
Okay, but I did hear that there was some truth, not necessarily behind that story, but when the AIDS spike was not in the 80s or 90s, but I think in the early 2000s, there was an AIDS spike, and it was in some of the senior communities. And they am I making this up?
I don't recall that. I will say that
I'm gonna look up the data.
there is a kind of not spoken about culture of swinging in the Villages. So like sexual circles and stuff like that. That does happen.
Look,
I now have,
look, I'm not
I
mad
have
at
so
him.
many questions now about my boyfriend's best friend and whether I need to have other concerns.
Come down.
But what I was saying, so the majority of the Villages actually spans 3 counties, but Sumter County has the majority of it. That's the northern part of the county. And that means my county actually has the highest density of those age 65 or older than any other county in the entire nation. So I have the highest concentration of the most at-risk individuals in one specific place in regard to COVID-19. And they're all
What could
like,
possibly go wrong? I mean,
what
they're
could
just
go wrong?
all high
In
risk.
Florida,
They're concentrated in one area and they're all getting laid.
and in Florida under DeSantis, and the Villages is Trump country. I mean, my county is Trump country, and it is interesting.
Look, I'm not mad at them. They have lived their life. They have raised their kids. They said, look, we're about to live our best life collectively. Let's do it.
You know,
Yeah,
that's
not
fine,
bad.
as long as they are, use condoms and keep masks on.
And see, that's where
Anybody's
that's
wearing
the
a
point.
mask during sex. So
You know what? I just say mask it up all the time.
is this going to go back to that New York thing about glory holes? Because I know what those are now. I didn't need to know.
I could see how this conversation went. Like, we said use protection during
Who
COVID.
started it?
We don't use protection, and they wear a mask, and it's like, that's not how this works. No.
Okay, this is a dirty but the best analogy ever. So you know how you don't wear the mask over your nose? It's like wearing a condom on your balls. It doesn't protect.
I like it. I like it.
Wow.
But
I
I,
like
but I did hear that that's where that came from, why there was such a spike, because of the generation. They came from a time where, you know, it was pre-HIV, and most of them were married or divorced or widowed, and now they're in these relationships and they don't connect, or they don't relate to that conversation of, you know, sex, premarital sex, or, you know, not realizing that, yeah, you're having premarital sex, you know, Betsy, you're a little promiscuous, you know, Thelma, but, you know, so use a condom. But they've always associated condoms with a different time.
Well, and pregnancy, you know,
Yeah.
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 I doubt any of these great grandmas are worried about finding out they're knocked up.
You never know, though.
The stranger things have happened after
Stranger things have
2020, and as weird as 21 has been. I'm not taking. There's nothing that could surprise me at all.
Right.
Unless Trump came out and actually, if Trump comes out and says, "I'm a good person. I did this to show you how vulnerable the nation is and how easily you are equipped." Ha! You've been punked like Ashton Kutcher. That's the one thing that could surprise me. That's all I've got left.
I would need proof.
I would need cold hard facts to believe that.
He's too mentally ill for that.
No chance.
Never happened.
So,
His ego would never
Megan,
allow him.
so Megan, hi, I signed on a little late, but welcome to the show. And if you have links to your social media, if you're on Facebook, IG, Twitter, or elsewhere, or Clubhouse, you should be on Clubhouse. Drop me a link and I'll invite you, but let us know, let our audience know where we can find you.
I keep my social media very private.
Okay.
Because people will find me often.
I'm not mad at
understand.
you.
I just changed my cell phone number after 25 years, so. I
Oh,
get it.
wow. Yeah. So you can't find me anywhere. Call me at work at the Sumter County Health Department if you need me.
Okay, because
I will take this on.
reason
If
why I'm-
anybody has questions for Megan, I will forward them to her.
Yes,
Go ahead,
There you
please.
go.
the
like
reason why I'm asking is because my best friend on the planet is will be moving to Florida soon, and Florida's buck wild crazy.
Yeah.
They're about as damn near crazier than Virginia.
Yeah.
So
Yeah.
Yes,
I don't want to have to fly down there and stab no senior citizens for messing with my friend. So yeah. So
I'm sure you have about 2 moods, Vanessa.
I want her to meet you so she'll at least have, you know what I'm saying.
That-
Where in Florida is she moving?
yeah.
I think she said either Key West or somewhere in that
Oh,
vicinity.
that's way far from Orlando, though.
Yeah,
That's
south.
that's
Oh, you're in
far.
Orlando. You're in Orlando.
Part of me, I'm in Palm Beach County, the one that Trump is returning to. We're so excited.
Oh my gosh.
Yeah, I hear
You
that.
guys are
Oh, I don't-
actually taking
Yeah.
him back. You guys are taking him back because Mar-a-Lago, the Mar-a-Lago, wherever Mar-a-Lago is, they didn't want him to come back there.
Oh, they're suing him. to stay
Yeah.
away.
Yeah, I suspect he's going to end up going someplace without an extradition treaty.
Exactly.
Last I checked, we could we could remove somebody from Florida, but I don't know. Florida's pretty wild.
Yeah.
Yeah, I don't know.
You do know the guy that stole the Lecter lives in Florida, has a doctor for a wife and 3 kids.
Yeah.
My friends are like, someone's gonna get a divorce. I'm like, but you got her such a unique gift.
One of the guys that broke into Nancy Pelosi's office is a former inmate at the Sumter Correctional Institution.
Well, you got some celebrities
believe
down
that.
there.
Only the best for Florida.
Florida is off the chain, okay?
I'm so glad I moved from New York City.
I don't
But
know
the-
who.
Me too. We're in New York City.
But the crazy,
The
Bronx.
remember Elmhurst Hospital that
I
was
like to make
the epicenter of the crisis that when it first happened, that's where I was born.
Oh, fun.
So no, wait, have we all lived in New York City? Because I lived on 16th between 5th and 6th for a long time, down by Union Square.
And I was on the Grand Concourse on 151st, 10
Oh.
blocks from Yankee Stadium.
I went to Bronx Science, so I always took the train that went right through it.
I'm from Co-op City.
Wow. Vanessa, where are you from in New York?
I'm from Midtown, on the corner of 42nd and 2nd Avenue near Audrey Hepburn Way. That's where I'm from.
are you serious?
No.
I thought you were in Big City. I was about to say, come on, Vanessa, don't leave me by myself on here.
Side of the street.
No, the story is that 90% of my friends, which I just realized this recently, are from New York. So I adore New Yorkers and I adore New York City, and I'm a big fan. And if I ever get wealthy enough to buy something in New York, that's where I will live. Midtown.
Yep.
51st,
block.
I
51st
have
and
always
2nd
loved
Avenue,
New York and New Yorkers.
51st and 2nd Avenue near Audrey Hepburn Way. That's where I will live.
So I think what's interesting is, there was that whole thing that they thought coronavirus was going to kill New York.
Mhm.
New York is
Nothing to kill New York, as you can see.
New York is a tough. People say what they want to say. New York is a tough.
Yeah.
Yeah, except for
Brazilian.
Staten Island. That's not New York City. I'm just gonna
No.
put that out there right now.
Or Long
Correct.
Island.
They're not.
Or Long Island.
Oh,
Bridge and
And
Tunnel.
anybody
Bridge
from
and
New
Tunnel.
Jersey who says, I'm practically a New Yorker. No, you're not.
you're Bridge and Tunnel.
You're not.
Bridge and Tunnel.
Her baby back, Dad. I like her. Her and Dr. Tower and Trip.
Yeah.
Yeah, well, I have had a blast. I don't know about y'all. I've had a blast tonight. Y'all have been something else. And just because of the lateness of the hour, I want to just say thank you so much for all of you that are watching and have submitted your questions and things like that. If you have any questions for Dr. Grant or Megan, please send them, put them in the comments or send them to Jamie, and we will make sure that they get your questions and answer them for you. Both of you ladies, we would love to have you again when we decide when we're going to talk about mental health, because I think it is a really good topic. Like I said, the conversation that we had before this conversation, I was just sitting there and just listening to it while I was trying to get us up online, and it was wonderful. So I think it's a conversation that needs to be had because too many people are not having it. So if you wouldn't mind when we reach out to you again, to please say yes so that we can touch on that topic, that would be wonderful. As always, Jamie, Kim, Vanessa, I know you weren't coming in tonight, but thank you for popping on. We appreciate your input as always. Ladies, you're wonderful. Couldn't do this without you. And I'm going to leave on this note. 46.
Are you guys coming to the party?
Yes, you guys are invited to the party.
Party on Wednesday.
Wednesday.
Right?
Yes,
at work.
Wednesday.
I'll be
Party
working.
on Wednesday.
I'm coming on during my lunch break. So
Oh, that's a good idea. I could probably do that.
If you can pop in, we're going to be on. You can pop in, pop out. Who knows? You might end up staying. Bring some of your coworkers on. Who cares? Just come on. Let us celebrate. We're going to watch our new president get sworn in.
Start soon,
and
right?
our next vice president.
And our vice. Oh, and I just need to say this too. So if you guys ever watch CNN during all of this, there was a reporter on there, young Black woman named Abby Phillips. And Abby Phillips, I thought, has always done, her and Caitlin Cowling have always done a wonderful job just delivering the information, straight, no chaser, and giving their opinions and the facts and the information. Abby is getting her own show, and I think Caitlin's getting her own show too. And I'm really proud of both of those young ladies because I come from a media background. So when I watch stuff, I watch it from that perspective. And I've always thought that they were great at what they did. So I'm really proud that the network has chosen them to give them their own thing to do. Abby is doing an interview tomorrow night on CNN at 10 o'clock. You gotta watch it because it is with Kamala Harris and her husband, who's the second man, I guess. I don't know what his title is gonna be, but I'm really excited because the 3-minute clip that I saw of what they're about to air was something that I haven't seen since the Obama administration. And that was people together that really love each other. So if you
That's
miss
10
that,
10 a.m. or 10 p.m.?
10 p.m.
Okay.
tomorrow night, Eastern Standard Time on CNN. And I'm telling, they talked about how they first met, and he was a lawyer, and she, I think, was district attorney or something,
Yeah,
and
she
it was a hookup. Her friend met him and thought that he was, you know, a good fit for her. So while he's dealing with her, she was like, you know what, I think I'm gonna set you up with my friend. And that's how they met. So it's a really great story. They giggle and they gaze into each other's eyes and are giddy, just like they probably were in the beginning. And it's refreshing. And that's why I'm sharing this with you, because it is going to be refreshing to see that we have an example of a relationship again, the way it should be in office.
So does he call her mother though?
I know, I was just about to say that.
What?
Does he call her mother? Because, you know, I've had boyfriends who like to be called daddy, but they never called me mother.
I don't think anybody, just because we call them daddy don't mean they call us mother. I think there's
Only for Vice President Pence. And
Yeah,
his wife-
Pence was like that.
His wife, yes, he referred to his wife, whose real name is Karen. Her name is Karen as mother.
that's
So I agree with Mary that it was very refreshing to see that clip. And, you know, as opposed to the most horrible president in American history and his stinking birther wife. Okay. So refreshing to have a change. So.
yeah. So if you
Her
got-
eyes just always seemed
go
like
ahead.
they were saying, "Help me."
Well, I think also we saw that love between Barack Obama and Michelle Obama, and that was so refreshing. And I also think we see that with Jill and Joe Biden. The way that Jill has, when somebody's gone after Joe, physically got in there before the Secret Service. I don't know if she's taking Krav Maga or how she's training for that, but we're not going to have these couples in the White House who love each other.
yeah.
Like, what a great
Yeah.
example for our kids.
Mhm.
Jill Biden, or as I call her, Jilly from Philly, is from Philly. Okay. So she ain't scared of nothing. And I
Dr.
love it.
Jilly from Philly.
Yeah.
Dr. Jilly
Well,
from
yeah, we
Philly.
want to go with the doctor because you know how that pisses off the far right. And just for anybody who doesn't know, I work in government. In government, we refer to people with PhDs as doctor. That's the way it works. That's the norm. In government, I know that in a lot of other fields, if somebody has a PhD, they don't use that. But in government, we refer to people with PhD as doctor. She is Dr. Jill Biden.
So Megan, can you explain to me what the initials behind your name mean?
Yes. I have a master's of public health, which is the MPH, and I'm certified in public health, which is a CPH.
Awesome. Thank you.
Megan, can we connect? Because I also want to go get my MPH, I'm thinking, and I'm even thinking in Florida as a really good trauma program.
Yes.
And Megan went to the University of Florida, both for an undergrad, right?
I actually went to the University of Central Florida for my
Central
undergrad.
Florida.
Yeah, and then University of Florida for graduate school.
Well,
I think I'll end up going to University of South Florida for my PhD. So I'm just gonna go to all the state schools and just,
Make a tour.
yep, yeah, just all the state schools. Yeah.
Mary, you're no longer in charge.
I'm just gonna lock it off real quick. Everybody, just say goodbye to everybody. Bye, and we see you on Wednesday at 12 noon
For the party.
for the party.
Kimberly and Jamie, you got to go to the party store and get your stuff.